Hello and welcome to Your Health Reclaimed with DrPND, where we help you reclaim your health with tips, tools, and resources to live your most optimal and vibrant life. Here's your host, DrPND.
Hello and welcome to Your Health Reclaimed. This is your host, DrPND. And on today's episode, I would like to discuss a very common topic that comes up a lot. I get a lot of questions, and that is regarding understanding the healing timeline. Basically, what to expect when dealing with and addressing chronic issues, particularly candida. So I'm going to discuss the journey with candida, but this is pretty much all across any chronic issues anybody is that is dealing with. So first, let's define chronic illness. According to the Center for Disease Control, chronic illness is a condition that persists for many months, more often than not for 1 year or more. Chronic illnesses can last sometimes for decades, despite ongoing treatments and medical care. So long-term, for example, overgrowth of the genus of the fungi called candida, it is something that I deal with a lot. It's a very common chronic illness. This overgrowth typically occurs in the digestive tract, and this is why I use a specialty DNA stool test to test for that. But candida can also colonize other areas of the body, like the skin, genitals, and also become systemic in the blood, which can sometimes lead to severe disease and severe symptomology. So while treatments, to effectively treat chronic diseases, do exist to some extent, there are many misconceptions about dealing with chronic illness. Okay. And this is what I really want to go over. Again, even though I'll use candida as an example, that applies to pretty much anything else. And understanding the healing timeline and understanding the process is extremely important, because this is one of the biggest reasons why people quit their program early, and they don't really get results, and they never really get anywhere. And I'm going to describe all of this. So I really hope you guys get a lot out of that, because it is a very important topic to understand and know, really keep in mind and keep that close, because if you're going under treatment under a holistic or integrative or medical doctor, or a loved one is, or somebody that is going to be, it's really important to understand how things work and what is the reality of the journey, and understanding the healing timeline, because unlike acute or traumatic issues that are addressed, whether allopathically or holistically or integratively, regardless, when you're dealing with a chronic issue that especially if it's long-standing, is going on for year or two or more, or decades, it's a completely different story. So therefore, having the proper understanding is very important. Okay, so here we go. Let's start with the common misconceptions. Okay. People think that there is a quick fix for long-standing chronic illness. There is not. Okay, it is going to be a journey. Misconception number 2: people think about that one size fits all for candida treatment or anything else. That is a massive misconception. This is why people would listen to self-proclaimed internet gurus and armchair experts that are usually self-proclaimed, or even some people that actually do a good job and they do good videos. But the problem is that even the best videos that are actually accurate, they are not presenting an individual treatment plan for that person. So people try to blanket statement, and they believe everything is the end all be all. For example, people believe that ketogenic diet or no carbohydrate diet, or like the carnivore diet, is an excellent way to address candida. Some people can be, for some people it's not. I can tell you right now that for most people, it's not going to work well. Okay, and there are many reasons behind that. So There's not a one size fits all. Okay. Another misconception is people underestimate the complexity of the chronic illness they have. Okay. Many people think, oh, I have candida, I'm just going to take some herbs, maybe cut out sugars and processed food and alcohol for, a month or two, and that will address the candida and be done with. And that's almost always not the case, especially somebody has had chronic candidiasis, has had it for a long time. The counts are very high. They have, substantial symptomology from it. It doesn't work like that. And again, almost always it does not. Another misconception is ignoring the impact of lifestyle changes. Perfect example, again, people think, hey, I'm going to take some supplements, some medication, or a combination sometimes. And, I might cut out alcohol, I might not, generally, eat healthier and they'll address that. It does not. As a matter of fact, there's people who think that they'll take the proper supplements and or medications and, focus on a, 100% custom tailored candida diet, and that'll address everything. And sometimes it doesn't. Because again, lifestyle factors really make a big difference. Another misconception is focusing on symptoms rather than root causes. I see that a lot. People come to me, a lot of times people have skin issues, with those infections, gas or bloat, and they'll completely misunderstand the root cause of the problem, the severity of the problem, and they will be hyper-focused on addressing the skin issue or the, digestive issue, for example, like gas or bloating. And that is not going to work because, you're not going to be able to address the symptom immediately. And what that causes them is to lose discouragement. To get discouraged and, lose the motivation why they started in the first place. So focusing on addressing the symptoms themselves is never a good idea. The symptoms very well might start to disappear and lessen, but not necessarily will. And in candida particularly, a lot of times things actually might get a little worse before they get better. Another misconception is people like fads. Okay, so they follow the latest and the greatest trends that are in healthcare, whether it be holistic or allopathic, regardless. Again, the one, very common. People always think, well, one supplement or a quick dietary change is enough to recover. It is not. I can tell you that even a slightest case that needs to be treated of candida is going to involve at least 4 different supplements directly for the candida. So there is not a single one supplement, whether it's the supplement itself has a combination of other individual supplements like herbs and other nutrients, or it's just one single preparation of herb, for example, that is highly extracted. There's no one. Yeah, in severe cases, there might be sometimes 7, 8, 9 different remedies that people will be taking at the same time. And the last one I see is they say, well, if I don't see results fast, I won't see them at all. Like anything else, nowadays people want to see results fast, like in days, maybe weeks. It does not. With candida, sometimes can take months, many months, to really address things fully and for them to recover. Again, it all depends on many, many factors. But these are the big misconceptions that I see all the time. These common misconceptions are harmful because they don't allow people to develop realistic expectations of their own treatments. So this in turn, that leads to disappointments, discouragement, and when the treatment doesn't produce the instant results that they're hoping for, they quit. Individuals who have been suffering, from candida again or other chronic, long-standing chronic issues, like particularly from candida overgrowth, sometimes for 10, 20 years, and a lot of the times they don't even knew they had that. Should never expect to recover overnight or even within many months. Sometimes can take 12, 18, up to 24 months or longer to recover fully, like full recovery to take place. Long-standing chronic illnesses take a long time to resolve. Okay. First, it has to be, understood what is a long-term, long-standing chronic illness. What does that constitute that? And only a relevant, practitioner or physician is going to be able to, diagnose that? Is only going to be able to make that proper call of, is this at a more of a acute, semi-acute, low grade, short, relatively term chronic situation, or has been a long-standing, deep-rooted chronic issue going on for many, many years. Okay, so chronic diseases, again, including candida overgrowth, they're complicated, requiring more than a single approach to resolve. Many, many times will require at least 2 or 3 different approaches to get resolved properly. And that only, of course, depends on the compliance of the person that is being treated, and how they react, what they do, and individual differences as well. Now we know the treatments like antibiotics and conditions like diabetes, can directly impact candida, for example. So, and our ability to fix it effectively. So that has to be taken into consideration. However, many individuals see chronic candida as an illness that can be resolved by taking a single course of a single tablet. And that is not the case. The purpose, again, of this is to, allow people to understand a chronic candida, what chronic candida is, and to set realistic expectations for recovery. All right. So we'll facilitate this by discussing how candida affects the body and how each person experiences differing symptoms and timelines for recovery. So then we'll go ahead and end this by providing a success stories, that kind of give you a general idea from people who have experienced, complete recovery after suffering for a long time. So the impact of long-term health issues. Again, like with any chronic illness, as I said, long-term candida can severely impact our health in different ways. And these include, number one, further disease. Candida causes inflammation in the gut lining, which causes discomfort and can lead to emergence of other chronic diseases such as IBD or inflammatory bowel disease or other inflammatory diseases. Number two, recurring infections. Chronic candida can and will usually lead to recurring infections in multiple sites in the body. Each new infection causes discomfort and necessitates another round of treatment with drugs that often have harmful side effects and often do more harm than really good in the long term, obviously antibiotic use. Number three, nutritional deficiencies. Candida prevents people from obtaining certain nutrients from the food, and it makes them crave foods that are honestly bad for them, because you're never going to see somebody with chronic candida that are craving organic apples and bananas and meat or sweet potatoes or vegetables. They're always going to be craving some kind of form of highly refined starch and sugar without fail. So over time, what happens? This leads to long-standing nutritional deficiencies, which of course affect people's overall health, and ultimately deplete the immune defenses. Mental health is a big one. Dealing with painful symptoms over and over without an apparent solution in sight. I mean, it will take a significant toll on mental health on anybody, pretty much. So candida overgrowth can emerge for various reasons, and there's a lack of education about the risk of candida overgrowth, which means many people have made themselves vulnerable without even realizing. That's something I want to make people aware of. There are various reasons, and people do literally make themselves vulnerable without realizing it. So here are some of the risk factors that I see. Prolonged course of antibiotics, that's a big one. Doing antibiotics indiscriminately over and over will do that. So, antibiotics deplete the healthy bacteria in our bodies. Everybody knows that. That ultimately these good guys keep the candida at bay. This means that taking antibiotics gives candida a chance to grow and regrow and overpopulate in the digestive system. So the other risk factor is poor dietary choices. Food plays a central role in gut health. Everybody knows that. And microbes in our guts have different food preferences. Candida loves processed starch, sugar. And by consuming high sugar foods, which most people do, they encourage the candida to grow at the expense of beneficial microbes. So you took a round of antibiotics, you damage your good guts, the good bacteria, and now you're eating processed food, and instead of feeding the good bacteria, you're feeding the bad bacteria, and that just explodes. and the candida proliferates and grows. Another risk factor is inconsistent treatment approaches. Chronic illness leads individuals to seek different treatment options. So while it's great to be proactive in looking for a solution, constantly switching between different methods is the worst thing you can do. It is not a viable option to treat long-term candida overgrowth or any chronic illness and issue ever. We call these people program hoppers. They'll go from program to program, thinking that somebody's going to tickle their fancy. They're going to tell them they can eat whatever they want. They can tell them that they're going to take 1 or 2 supplements. They'll be good to go without any kind of change of lifestyle habits or dietary intervention whatsoever. And you see this all the time. We call those people program hoppers. They just keep going from a program to program, from person to person. So this risk factor is rooted in the first misconception about long-term candida overgrowth. And there is always a quick fix, and you just need to find it. That is their mentality. There's a quick fix, and they just need to find it. So therefore, they're just going to keep going from program to program. It's just a bad move on all aspects. It never works well because there is not a quick fix. Okay. Trust me when I tell you, it will make my life much easier and dealing with people much easier if there was a quick fix for anything. I wouldn't have this profession if there was a quick fix. So anyway, when taken together, these factors compound, leading to decreased well-being and optimal growth conditions for the candida. Bodily system, by the way, affected by this can include the immune system, everybody knows that, digestion, obviously, metabolism, cognitive ability, alertness and energy level, liver function, and toxic overload, okay? And this happens, I see this all the time. Understanding your body's healing process, okay? Let's talk about that. Let's talk about, truly understanding how does the body heal. So the healing process in the body take different lengths of time depending on the type of illness. Unfortunately, people can fall ill quickly, while getting better again takes more time. The longer we go without finding an effective strategy, the longer it can take for the healing process to begin. That's something to really understand. Healing from any illness is like fixing up an old abandoned house. When a home has been empty and neglected for a long time, it can be made new again overnight. It takes time to clean it up, repair everything, and make everything work properly and look new again. It takes time. There's no difference. This analogy is very, very accurate. Similarly, when your body has been affected by illness, it needs time to recover and repair itself. It will not happen overnight. You can't rush the process. That's the thing. You cannot rush the natural healing process and the chemotaxis of cellular function that the body has to take and go through in order to repair itself, okay? But with patience and care, things slowly will always improve. That's a fact. Healing must occur in layers. It always does. And the root cause must be addressed gradually. It's not a one and done deal. In other words, there's no point decorating until you've fixed the problem with the foundation. Okay, it's like going to a house and trying to decorate it with the most expensive aspects, and while nothing in the house is being fixed, there's mold, there's rot, there's the foundation is cracked. It's not going to happen. And I hope this is a good analogy for you guys to understand, how the healing process works. Okay. Let's go to the other one here. We talk about the one size does not fit all. All right. I mean, everybody deals with disease differently. Okay. And one person's candida overgrowth will behave differently to the next person. It's just a fact. That means that we should not expect everyone to have the same path to recovery when talking, when tackling candida overgrowth with any kind of protocol. In our experience, helping our clients deal with candida, we've seen individuals fall into 4 main categories with regard to their recovery. Those 4 categories regarding the recovery trajectory, by the way, stands true for any chronic illness and issue that people deal with. Number 1, quick recovery. People who spot warning signs early and take a decisive action are more likely to see quick recoveries. For example, if you take course of antibiotics and notice digestive discomfort a week later, adjusting your diet to avoid those, the avoid foods that support candida overgrowth, and taking the proper supplements, like especially proper strong multi-strain probiotics, can make all the difference. Okay, so this might be a person who is generally healthy on the levels, never had issues before. They got infected with candida by whatever means. They found it out quickly. They took quick action, and they get real strong. They didn't have antibiotics or antibiotic resistance of any kind. The antibiotics worked, and they immediately began to address the gut and do a antibiotic recovery protocol, which I do these all the time. And these people are good to go. Okay, partial recovery. These are the biggest group. Okay, we see this with regard to recovery. These are people who look, who took early action against candida's overgrowth or other issues and ended up relapsing and experienced symptoms for a longer time. Ultimately, these individuals realize the problem and take decisive action the second or the third time around. So these are people that start, they take action, they're proactive. A lot of the big reason for that is they'll feel better quickly, and they'll stop the programs or they'll deviate from the dietary intervention protocol almost always. People do really well with supplements, but they don't do well with diet. And they'll start eating whatever because they feel better. They relapse, they hit them hard again, they go back on the diet, they go back on the protocol full tilt, and they heal, or they relapse again, third or fourth time, and sometimes I had probably the worst person I've had is taken about 9 different times to get on protocol, feel better, relapse, come back, feel better, relapse again. And it took them 9 times to learn the lesson. Finally, they did. Okay. But that's the partial recovery. The third scenario is almost recovery. So this group goes through multiple rounds of, feeling like they're getting better before relapsing repeatedly. This takes literally a significant toll on their mental health. That's what the issue is. And in many of these cases, the individual has a specific behavior that is preventing recovery, usually, almost always. And again, this can include alcoholism, drug addiction, severe food addiction. It's some kind of behavior that it just takes him to go. And a guy, he was addicted to, I would say he was addicted to alcohol ultimately, but he loved gambling. And twice a month, he'll be going to, Vegas to gamble. And he was doing perfectly fine. But as soon as he won that Vegas weekend trip, he'll relapse. Okay. And why? Because he drank. So him playing, whatever he was doing, Texas Hold'em poker or whatever he was doing, the part of those drinking, his body's had a great time, but he'll relapse and he just can never recover. Okay, and that took a significant toll, but he just couldn't get it. He just couldn't. And again, there's always a behavior pattern there. So the other one, the last pattern, is the people that never recover. These are the individuals who experience long-term symptoms but never fully commit to a proper recovery program. They may believe in a quick fix or not, or unwilling to address their symptoms root cause. I don't know. But ultimately, this means that they suffer from symptoms for a long time, though they may experience a partial recovery now and then, but ultimately they go right back down to where they were, and they stay there. And they either give up completely and just live with their symptoms, or keep going back and forth trying to do something. And oftentimes they'll go back to medical intervention and take antibiotics, feel a little bit better for a time, for a few weeks, and then until the candida grows again, and just they keep digging that recovery grave deeper and deeper ultimately. So let's talk about why some people never really recover. Okay, now there are obviously many reasons why people fall into this category, but the most common ones include the following. Well, for one, misdiagnosis. So many of the symptoms of candida overgrowth are similar to those of other issues like irritable bowel syndrome and so forth. So this means that individuals often get the wrong diagnosis and therefore the wrong treatment from their healthcare provider. Now, I have to admit that what I see here the most with people like that is that with other practitioners or doctors that have never tested. And they guessed, they didn't test. They went by the people's symptoms And more often when people go to somebody, they'll self-diagnose already. They'll go on Google, they'll go on ChatGPT, they'll put all of their symptoms, and they'll come with the belief that either 100% they have candida or they're pretty sure they have candida. And I can tell you oftentimes that I'll run tests that they'll nothing to do with candida. Again, that's why we have to do accurate testing. You cannot just guess. When the candida came on board back in around 2010, 2011, that became a massive fad. I mean, everything was blamed on candida. Anywhere from the people's gas and bloating all the way down to their divorce and their bankruptcy. I mean, everything was basically candida's fault. I mean, there were tests like stupid spit tests, and I mean, ridiculous stuff like you couldn't believe. There were books written, protocols done. I mean, you name it. And like anything else, it kind of fizzled out because naturally people after a while understand, well, it's really not candida. So testing is huge. That's why you do not want to get misdiagnosed. Okay. And please don't diagnose yourself on Google and ChatGPT, for the love of God. So on the other reason that I see all the time is poor follow-up care. So many healthcare providers, will prescribe a one-time treatment, but will fail to provide patients with proper follow-up checks or long-term recovery plans, especially gut recovery plans after antibiotic. So this gives individuals a greater chance to relapse and to receive a misdiagnosis and follow-ups because healthcare providers assume the initial problem has been dealt with, obviously. But people who, hop between doctors that are particular, people I was trying to say is that people who hop between doctors are really a particular risk for this because they go from doctor to doctor and they don't really tell, I've been to this doctor, this will be prescribed me, or there's not a proper documentation in the medical records, but they get this quite a bit. Okay, now this is more prevalent for medical conventional care because they'll prescribe antibiotics. And antibiotics obviously will do damage. So again, if somebody has candida and it's true or whatever it might be, they take antibiotics, they feel better for a little bit, usually because the candida count does go down, it gets killed off, but it never gets eradicated. So it's just a matter of time until they go back to their unhealthy eating habits and the candida starts to, repopulate and grow and explode. And then it comes back usually with a vengeance. The other issue is poor response to first treatment. Some folks discontinue treatment course after initial bad reaction. People may feel like the treatment must be wrong if they feel bad and after taking the prescribed medication usually, and that includes also herbs and natural protocols. In many cases, this is an issue with the dosage and may even indicate that actually the treatment is working. So a lot of medical doctors they're not familiar with die-off reaction or Alzheimer's reactions. So therefore they want advice. So a lot of times when people get prescribed antibiotics and they get sick, that people think, well, I got sick from the antibiotics. You did not. Actually, the antibiotics did their job and you experienced a massive die-off reaction because one is not done properly and or the antibiotic standard prescribed dose was just too high. But it happens. It happens also with natural supplements. That's why communication is so important. Then make the person understand, hey, this is what's going to happen, and this is how it's going to happen. It's not guaranteed it will happen, but if it does, here's what to look out for. Don't be discouraged. And when you communicate properly with the person, and they expect that, if anything, many times people say, hey, I got this die-off reaction you're talking about. I'm excited because it's working. But it's how they perceive it, as opposed to just, here, take this, you're going to feel better. And they get a bad die-off reaction, and they freaked out. They think it's not the wrong dose, the wrong medication, the wrong supplement, and they quit. So you have to understand and respect the psychology of the people and ultimately communicate with them really good. The following reason I see a lot is people giving up. This is just one of the most common reasons for failure. People simply give up on strategies without giving them a time and a chance to work. As I said before, candida can and usually does take a long time to deal with effectively. Giving up early guarantees failure every single time. The other thing that I see is thinking, again, one solution is enough. Effective recovery from candida takes more than supplementation or diet in isolation. Okay, instead it requires a commitment to healthy lifestyle, which includes diet, education about risks, and big one is stress management. High chronic stress alone, it can be enough for somebody either to retard the healing severely and or even not to heal, period. Okay. Supplements are a great way to support recovery, but when taken alone, okay, they're insufficient for lasting health. Okay, this is what people have a hard time understanding. Think, okay, I'm not going to go to a medical doctor, so I don't take medications. I'm going to go to a natural doctor, so I can take supplements. Well, that's not going to cut it either. Sorry to break it to you. Okay, supplements alone almost always never work. Okay, it's a hard concept for people to understand. The other risk here that we talked about is continued exposure to risk factors. Many people change their lifestyle, but fail to commit in areas that carry a high risk. This includes continuing to consume alcohol. Alcohol is a big one. I've done 2 podcasts on the dangers of chronic consumption of ethanol. Okay, and so when you do that, you just continue to take risks. A big one also for females is continuing to take oral contraceptives. Okay, and for many folks, especially older people, just failing to, among other things, failing to adopt a regular exercise program and failing to adopt a stress reductive program. So these are, again, exposure to risk factors that just people don't count. Low grade stressful lifestyle. Okay, that's a very misleading one. That's a very slick one that it gets past many people because they don't catch it. Okay. And I say low-grade stressful lifestyle, not high chronic stress, but low-grade stressful lifestyle. And that means that's a low-grade chronic, slow-cooking stress response that goes unnoticed for many, many years. So unfortunately, many people fall into this category. Okay, they may not adapt many recommended changes, but have a poor sleep schedule due to shift work, for example, or dysfunctional relationships that cause them constant stress. Okay, these factors can and will contribute to treatment failure. Right? They might have a job that they're actually thriving in, and that job is making producing financial return that takes care of them and their families. They're thriving in it, but it's causing low grade stress. I've seen toxic relationships. Yes, they might not be throwing plates at each other and abusing each other physically, perhaps even not even directly verbally, but just the chronic low grade toxic nature of the relationship, whether it's just continuous dissatisfaction and resentment, whatever it might be, that is just eating them alive, literally. And again, that will contribute to treatment failure. It does. A lot of people don't understand. I see people with even having roommates that, your friends or just a roommate in general that, generally they get along really good, not having problems directly with each other, but because one of them has chronic anxiety and stress, the other one absorbs that energy. Okay, and it does happen. If you don't think it does, it does. So these things have to be addressed. All right. Let's talk about misconceptions about recovering from candida. Okay, or again, any other chronic, deep-rooted chronic issue. So, as I said, many people with chronic candida think that their recovery will progress linearly. It does not. They expect to feel better and better until eventually they recover and they're on their happy way to doing their old things and lifestyles again. It's not going to happen. This isn't the case with most candida cases, especially long-standing ones. It is not a linear treatment, and things are not up and up and nice, easy, forward, positive, smooth sailing. It is a up and down, and many times down deep, dirty in the lowest ravines that you can imagine. Okay, and this is where strong mentality comes in. You have to have resilience for that. So, individuals will typically see a lot of improvement in the first few months of adopting a recovery plan, which can lead them to, feel bulletproof or feel like they feel really good, or it actually, the misconception is I feel really good and therefore I've actually recovered, and they haven't. So when this happens, many people, let their guard down and fall back into poor diets and poor unhealthy lifestyle habits. which usually is the first place where they got them there. From there, they'll often question whether the treatment plan has worked at all, when in reality, they haven't adopted it properly. Eventually, many of these people recommit to the plan and begin to see results again, and some fall off. Again, I'm just speaking about my experience. I've consulted with other clinicians, and generally speaking, 95% of the time, that is the case with everyone I've ever talked to, and their experience with their clients and patients, and how people generally react. So, we like to think that, we'll stick to a plan, but, life gets in the way. And I get this. This happens to all of us. And it isn't easy or possible to be perfect at all time. And that's why I always say is not about perfection, but continuously moving forward in the right direction. Okay. I never expect perfection for myself, even though I'd love to. But I was never able to attain it in my healing journeys. And I certainly don't expect it from any of the folks that I work with. Okay. And I let them know very well. Slip-ups are normal and completely understandable part of the journey. Okay. But they are a common reason why individuals who experience significant ups and downs on the road to recovery rather than a simple linear road. And they just have to respect that. So really the key is to keep going strong forward, knowing that you're going to mess up. But those mess ups, those falls, those trips, they have to be intermittent, and they have to be short duration, and they have to be a lot less than the progress. So that's why if people do what they're supposed to with perfection 100% of the time, almost always you're going to see a lot even and linearly positive slope of healing. But again, we understand life happens, and a lot of things are not dependent on us. And I tell people that, but ultimately it does make a difference of how consistent you are and how you handle failures, and how fast you're able to get back up. So let's go into how to know when we are getting better. Okay. Well, everybody again has a different road to recovery when it comes to candida, as I said that before. However, there are some common stages along the way that can help you take a stock of your recovery progress. You may, these are the ones that I see the most common patterns, and these are the ones that I'm going to share. Okay, there's 6 of them. First, there is fatigue and headaches. These are common symptoms of removing problematic fruits from the diet. Many people think that it's because the candida die out, but in reality, it's only a tiny percentage of highly sensitive individuals that really experience symptoms, heavy symptoms from a true die-off reaction. Again, we're talking about if they're not misdiagnosed, they're taking the right supplements. In my case, I don't deal with prescription medications or any medications. So right supplements that are dosed at the right dose and administered at the right time. Okay. And I don't know what to do. I know how to use those those remedies. So the die-off reactions are really minimized. Okay. Now, a solution to fatigue and headaches in the early stages is to slowly introduce a healthier diet rather than going cold turkey. And that usually helps people quite a bit. That's why when I work with folks, I always run a very comprehensive food sensitivity test to be able to see what foods trigger them and what foods are inflammatory. Some foods are easy. You're going to remove gluten. You're going to remove processed food. Okay, sugars of any kind. They're just a given. Okay, limit fruit. In some cases, eliminate fruit. Doesn't matter whether you're sensitive or not. But some of the healthy foods that people should eat as part of a healthy healing diet, if they're sensitive to that, we have to eliminate. So the only way you're going to know is if you run an IgG food sensitivity test, which I did a podcast on actually last time. So number 2, digestive problems. Starting a healthier lifestyle and taking supplements leads to changes in the digestive system for the better, but nonetheless it does. This is exactly what we're aiming for. But in the early stages, it can cause discomfort as your digestive system adapts to the changes. Okay. Number 3, sense of well-being. I see this a lot. After the initial phase, you'll see noticeable health improvements, depending on your symptoms, of course. But these may be less, this may be like things like, less itching or less digestive discomfort, like bloating and gas, or complete elimination of those. So for many people, there'll be a significant improvement in mood and feeling of hope for the future, which that's a positive. That's really good. Okay. Number 4, setbacks. People can hit this phase again and again, and happens, but it is a normal part of the journey. The key is to, as I said, not about perfection, but constantly moving forward in the right direction and getting right back up when you fell off. So you fall, you get right back up and keep moving. Don't look back, don't feel bad, keep going strong. So in this stage, people relapse and begin to experience symptoms again, which can come with feelings of what? Hopelessness, of course. Especially you've been mistreated, meaning they have not been addressed the issue properly with other people, from conventional doctors, for example, and you've been struggling this for a while. When you start feeling better, then you regress. Well, of course, it's going to bring hopelessness. So while it can feel discouraging, it's important to remember that this is a very common situation, and I always encourage people to take it as a learning experience and recommit recovery. Why? Because when they fall, they do something stupid they're not supposed to. So instead, like, don't feel bad, don't feel guilty, but just learn from it and use that as a tool in your toolbox going forward, not to do it again, hopefully. Okay. And if you do it again, if you trip again, this you're going to immediately know what happened. So again, it's a positive mindset and how you perceive things. Number 5, improved quality of life. As recovery continues, many people experience dramatic improvements in their quality of life, just as is supposed to happen, of course. This can mean enjoying the things that candida issues prevented them from doing, or simply enjoying not experiencing continuous pain and discomfort. Like, it can be both. Some people have been suffering for so long that simply being without pain or discomfort of some kind for extended period of time, it can feel miraculous to them. And number 6 is the end stage recovery. This is similar to the 3rd stage, but it lasts far longer. And many people in this stage consider themselves recovered. However, it is still possible to have setbacks at this point, and individuals must keep a healthy lifestyle to remain in this stage consistently. Here's the hardest part of this journey. What people do not understand is that the reason why they have chronic issues, okay, not acute, not trauma, but chronic, especially long-standing chronic, is because not that something happened to them, is because of their lifestyles. It was the cumulative choices of the different lifestyle habits between, how they think, how they eat, how they drink, how they work, how they sleep or lack thereof. All those things came together to contribute to their chronic problems. Even if somebody has taken a round of antibiotics, they might say, well, I took a round of antibiotics for like 2 weeks, 3 weeks, a month, and after that, I was never the same. Well, that is what threw you over the edge, for sure. But it most certainly was not what kept you in this chronic condition. And in the first place, didn't start that. That was just the proverbial straw that broke the camel's back for you. Okay. So it's not because you went on antibiotics and everything went downhill from there. It's because you're prone to that. Your body was not optimal because of your lifestyle habits. And then the antibiotics or whatever might else have been, it just tipped the scale. Simple as that. Okay. So this is the hard thing to understand. When people engage into a healthy lifestyle healing program, of course, they're going to be stricter. Of course, it's going to be a lot more intense. But when they heal, they assume that they can go back to living the debaucherous lives, the lifestyles that they used to living. You can't. Yes, you're not going to take all the supplements. Yes, you're not going to be as strict and intense and restricted, but you're not going to go back to eating, drinking, and being merry and on your way and doing whatever you wanted to like before. Just not going to happen. It'll be only a matter of time until the issues return or a new issue develops. It's just a fact. So the sooner you understand that, the better. The only way out of chronic disease is when you address your particular issue with a customized, individualized program of whatever that might look like. After that is going to be the changed, healthy lifestyle that are going to keep you going and going to keep you lasting and not returning to that state again. Okay, when you guys understand that, that's when you're going to win this game. Because again, one of the biggest issues I see is people continuously, I'm talking about people that successfully get through my programs, they heal, they feel great, and sure enough, it can be, many months, a year, 2, 3, 5 years down the road, come right back with the same thing or with something new. So I really, really hope you get that and let this sink in. All right, let's move forward because this is going to be a long one. Next, let's talk about setting realistic expectations. So as we discussed, recovery from candida or any other chronic issue is a continual process that differs from person to person. Don't ever compare yourself to anybody else. The key takeaway is to be patient and remain consistent with the treatment plan that you have been issued by your practitioner. Okay, the longer you have been dealing with candida or any other chronic issue, the longer it's going to take to recover from it. That's the bottom line. Now, the good news is that if you've been dealing with something for, say, a decade, it's not going to take you a decade or 5 years or even 4 years to get through it, but it might take you the very least many, many months and sometimes up to usually 2 years to fully heal, which is not a problem considering you've been dealing with this for 10 decades. So don't think I've been sick for 5 years or 10 years, then it's going to take me that long or even half of that to heal. It's not. Okay. But still, it's not a week and months, aspect. Okay. So this is just the truth. Okay. That's the way it is. And that's a hard truth. And the hard truth is that if you continue behaviors that made you sick in the first place, as I said before, then it will likely that you will never recover. Just a fact, I never seen it. So even if you commit to recovery, you should expect to experience setbacks along the way. That's just a fact of life. This is very normal, but it's how you proceed, okay, how you handle those setbacks. So when this happens, it's important to learn what you did wrong, okay, whether you ate wrong, drank wrong, let yourself get overwhelmed with stress, whatever. Recognize things in the future. As I said, have this as a tool in your toolbox and take preventative measures in the future not to go there. And even if you go there again, at least you're going to be able to rebound right back up and know what to do. Sometimes, for people, it takes us many times for us to beat heads against the wall to learn our lessons. And there are people like that. So it is difficult to establish timelines for recovery because everyone is different. Okay. However, there are very rough, and I emphasize rough estimates based on my experience. People that are generally healthy, especially very healthy, they're younger or younger. Quick recovery, what I call quick recovery, is 4 to 6 months. Sometimes can take up to 3 months just to get stable, but nonetheless, 4 to 6 months. Partial recoveries, these are usually 6 to 12 months. Almost recover. Sometimes those people can take literally years. Okay, and of course, they never recover. These individuals in this group can go decades without recovery. They just typically never commit to a recovery plan and continue to look for quick fixes, as I said before, and they just continue to believe in unrealistic timelines and suffer indefinitely as a result. Okay, but many factors can affect how long it takes to recover. But it's important to emphasize that you won't see results if you don't follow through. So going back to the recovery, if you have people that have been struggling for a while, it can sometimes take 12 to 18 months. And people that have been, depending, folks that have a hard time hanging in there, they keep relapsing, going back and forth, it can take years to fully recover. And the full recovery will only take place once they learn their lesson and they're able to stick to protocol. Okay, so it's not like, okay, well, I'm going to keep falling, tripping, having fun here and there, and relapsing and getting back on protocol, relapsing, getting back on protocol, and eventually I'll heal. No, it's not going to happen. As long as you don't give up, you're going to get to the point that you will not trip as often. So, for example, say you tripped every weekend, then after a while you only tripped, twice a month, and after a while you only trip 1 weekend a month. Then after that, you end up going 2 or 3 months without tripping, and then you get to the point that you're so consistent pretty much that instead of tripping, once every 2 or 3 months for a whole weekend, you just might trip once every 3 or 4 months with just one bad meal and something small that you're not supposed to get. Like I gotta have a big piece of cake once every 3 months. That was the only thing I did. This is what kind of recovery I'm talking about, that the consistency, it will take long to get to that discipline level that you need for your body to actually heal fully. And then again, that can take many years. But if somebody's generally really consistent, they're disciplined, they learn quickly, they can recover, fully as soon as 6 months, and sometimes up to 18 months, 24 months in some cases. If they have something else going on, if they're not as healthy to begin with, they're much older, there are other issues. But the bottom line is, if you commit, you'll be able to heal. Okay. So factors that affect recovery include, age. Older people may take longer to recover due to poorer immune responses and the increased likelihood of risk factors like other treatments, diabetes, hospitalizations. Not to mention, the older the person is, after the age of 40, the more medications they're on, and those medications can damage immune system, lower immune function, interact with other things, make things worse, you name it. So that can be a problem. Somebody has GERD, for example, and they're taking a PPI, like Prilosec or something like that. Well, that can affect the healing time for sure, because their acid is not strong. They're also more prone to getting reinfected from oral contamination. So the other factor is overall health. Poor general health prolongs recovery for all diseases, doesn't matter what it is. Okay. Dealing with other issues at the same time can and will make Candida more challenging to manage. And one reason for this is that our immune system is important for defeating against Candida. If it is diminished, Candida has easier time surviving inside the body. And this is the hallmark of healing from any chronic disease, is optimizing the immune system. So in the Candida, it's not just eradicating and removing the Candida or whatever other pathogens might be, and then rebalancing and repopulating the healthy gut bacteria, but is in the meantime, you're actually building and optimizing your immune system. So when the Candida is eradicated, removed, or at least the great majority of it, when your gut is healthy and is rebalanced and repopulated with good, healthy bacteria, your immune system is optimal. Now you have a sphere in there that will not allow that Candida to grow or even become pathogenic, even if there is some remnants left. That's what the key is, because if you don't address the immune system, it won't be only a matter of time until, the Candida reignites again. And third recovery, factor is lifestyle. Very important. Adopting, as I said before, a healthy lifestyle is essential to recover from Candida. Conversely, a poor lifestyle can and will cause Candida issues. That's why failing to adopt a proper healthy lifestyle slows and often prevents Candida recovery and healing, or any other chronic disease in that matter. So what to expect in the first months of using, Candida protocols, considering the design properly, and a Candida appropriate diet. So as we mentioned, everyone's experience with Candida is different and they react differently, meaning that everyone will respond differently to adopting, the proper supplemental protocol and a healthy dietary intervention change. Now here are some things that, many individuals will experience in the early months of the treatment. This is usually across the board. Initial bad reaction. Adjusting to a new diet and treatment plan can take some time. Individuals may experience an initial bad reaction, including digestive discomfort, headaches, bad breath, general fatigue. Nothing bad, but just unpleasant. Setbacks. We've mentioned this before, but it's essential to understand that setbacks are a normal part of recovery. Sticking to a plan can and will change. It will be challenging, because the change is hard, and it will be challenging. But it's important to start again after setbacks and not let them derail the whole process. So again, not about perfection, but continuously moving forward in the right direction. If you fall, get right back up. Don't feel bad, don't feel guilty, don't look back, keep moving forward. Here's another one. Improved symptoms. You may see improvements in symptoms almost immediately. It is possible. While others may see effects only after a few months or even months. It just that's the way it is. I have examples with different people, seemingly with similar cases, but completely acting and reacting differently. So the other one is the improved mood. Many individuals will experience a fresh outlook on life after taking and doing healthy, properly designed candida protocols and adopting a healthier lifestyle. They just feel better. It's a fact. You feel physically better, you're going to feel mentally better. This comes in hand, obviously hand in hand with improved symptoms. So making it easier to stick with a treatment plan. When people see improvement and they see some wins, that keeps that motivational fire going. Okay. It works really, really well. And that's why it's important to have the proper plan, the proper diet, that gives the people ability to start seeing and feeling improvements. And so they can keep moving forward. So the last thing I want to mention is, just the role of comprehensive care. Chronic candida or other chronic issues, requires a tri-armed approach to resolve, which is at odds with what many people think. Okay, some individuals believe that there's a quick fix or one magic pill, as I said before, for dealing with any chronic issues, including candida. However, from my experience, and my colleagues' experiences, we know that it takes consistent effort over a long period of time with dietary and lifestyle changes and careful supplementation to see good results. Okay, that's just a fact. There's no way around that. Okay, stress management is huge, and that's why it's such an integral, important factor here. That's why I want to end with that, because I cannot tell you if people living with anxiety and fear and other chronic stresses, they just cannot heal, and oftentimes when those stressors are even reduced to a good degree, they immediately improve, at least to some degree. Once those stresses are removed or addressed, healing usually falls right away, as long as they don't give up. But stress is extremely important. And it is worth mentioning, by the way, that when people come to me with issues, let's talk about it, say they believe they have candida and they test negative. A lot of times they'll get flustered and say, well, maybe that was the wrong test, or maybe the test was wrong, and so forth. And I do a thorough assessment with people. I look at their lifestyles, I look at their current and past medical history. I dig deep. You have to understand people's psychology. It's very important. You have to understand their personality traits. And I can't tell you how many times it is the people's chronic stress, usually following some kind of trauma or some kind of life event or events, that set them off on a bad path. And with fear, living with fear and anxiety and just anger, that the body started to exhibit physiological symptoms from their psychological chronic stress. And they never had candida in the first place or anything else that matter, but it is just that chronic stress. And sure enough, some rejected it, some understood it, they fixed it, and they got better and they got well and they're on the way. But chronic stress is not easy to fix. It's not something you're causing yourself. It's a direct approach of addressing it. It can take a while to usually mitigate. So that's why good mental health is beneficial in its own right, but it also helps with sticking to treatment programs. So individuals need to deal with other issues that might be preventing proper recovery. Again, these include treatments for underlying conditions such as alcoholism, which I see a lot, drug addiction and depression. Let me tell you this. When I say alcoholism, we're not talking about the blatant alcoholic that starts to drink from morning to night and they're belligerent and they get wasted, or even the semi-alcoholic. I'm talking about people that like to have their drink, even if it's just at night. A few drinks. It can be a couple beers with a couple shots of tequila. It can be cognac, whiskey. A lot of people like to collect whiskey. It's a hobby, and they drink. That is alcoholism. Okay, if you need to drink on daily basis to address your stress, to feel good, to feel better, that is by definition alcoholic. Okay, you don't have to have the genetic propensity and the usual, standard of diagnosis for alcoholism. That is being addicted to alcohol. Drug addiction, that can be being addicted to Tylenol or NSAIDs because people are so inflamed and in pain or aches, discomfort. Obviously, opioids, that's a big one. Benzodiazepines, that these are, like Xanax and Valium, these are also very common, I see. And of course, depression, that's a multifactorial problem that, it's out of my league and scope of practice, but, a lot of people cut themselves short for those. As I said, I did 2 different podcasts on alcohol, and I really encourage you guys to listen to that. So we encourage you to use, your journey of health. If you haven't embarked on the opportunity to really gain holistic wellness in other areas of your life, and create a lasting, healthy lifestyle habits that will serve you and will serve your family and ultimately your community. Because chronic disease is an epidemic, as everybody knows. We're approaching, perhaps even we might have even passed the 70% of the population mark of some kind of chronic disease. Kids are getting sicker, and things just getting, worse and worse. And it is our lifestyles, our food choices that is driving them, nothing else is. Okay. And that includes obviously the chronic stress that we live in, and which oftentimes we put ourselves into, and is due to our own creation. But the message is this: health is your greatest wealth. And if you don't have health, you really don't have much. So I hope this, long podcast helped. It was definitely over an hour. But, reach out to us. Go to DrPND.com, connect with us on social media. I offer free consultations. Reach out to us. We'd love to talk to you. We'd love to help you if we can any way that we possibly have the experience to do so. But if you have any questions, again, go to DrPND, look us up, reach out, connect to us. And I wish you guys a, happy and healthy day. And until next time, this is, again, your Health Reclaimed with DrPND. Have a great day.
Thank you for your valuable time and for listening to the Your Health Reclaimed podcast with Dr. PND. Be sure to hit the subscribe button and share this episode with a person you know it can help. If we can help you in any way, or you would like to connect with Dr. PND, please visit DrPND.com. That's DrPND.com.